Sleep apnea is more than snoring or poor sleep. It's a condition that can affect energy levels, heart health, focus, and overall quality of life. And many people don't even realize they have it. The journey begins with awareness. Symptoms like daytime fatigue, morning headaches, or disrupted sleep are often early signs that something isn't right. The next step is screening and evaluation. Simple assessments help determine risk and guide patients toward the right diagnostic path without unnecessary delays. Once sleep apnea is identified, diagnostics and digital consultations help patients clearly understand their results and care options. This connected approach allows patients to receive guidance, ask questions, and stay informed throughout the process. For many patients, oral appliance therapy offers an effective and comfortable treatment option. These custom-fitted devices help support the airway during sleep and can significantly improve breathing and rest. Finally, ongoing monitoring and follow-up ensure treatment continues to work as needs change over time. A complete sleep apnea workflow gives patients clarity, confidence, and long-term support for better sleep and better health.